Thank you and welcome. I'm going to share with you the following topic: health licensure and accreditation. In the next slide, we are going to see the outlines that we are going to discuss in this presentation. The first one is the definition of licensure and accreditation, the purpose and benefit of health license, the purpose and the benefit of health accreditation, the major differences between licensure and accreditation in healthcare, key national initiatives targeted at improving healthcare, and finally we will conclude. So let's start from the definition of licensure. Licensure is the process by which a government authority guarantees or gives a permission to an individual practitioner or an health organization to operate or to engage in an occupation or a profession. So while on the other hand, accreditation is the formal process by which a recognized body recognizes the health care organizations meets the applicable predetermined and published standard. This is where you find that there is a body which assesses and recognizes that there are some standards of which are set if the organizations meets the standard or the health facility meets the required standard. So the 12 processes are aimed at improving the quality of health care. So moving to the next, we are going to see the purpose and benefit of license. So in the first place, examination of an individual credentials. This is aimed at determining the education and the experience if it meets the legal requirement. This is with the aim of creating safety among the consumer or consumer protection. Inspection of educational program. This is to determine whether those programs they meet the required standard. Administration of exam and test of professional qualifications. You know, like when they need to know that you are area of specialization or you are able to account for your professionalism, then they give you exam. When you pass, they will actually determine if you are qualified in that field. So granting of races on the other basis of predetermined reciprocity to an applicant and of other judications. Another important thing is about instance of regulation establishing professional standard practice. So this is aimed at looking at the best practices or standard of practices, like in different areas. Does the health facility, does the health organization meets the required standard before it's given a license? Investigation of charges or of violation of standards. Sometimes this body or it works to charge people who violate the said standard or they don't meet the required standards. Let's look at the purpose of accreditation. Accreditation is aimed at improving the quality of healthcare, stimulate and improve integration among management of health facilities. This is what we see. Establish comparative database of healthcare organizations. They are able to look at different healthcare organizations and try to compare and see which one is meeting the best practice or the required standard. Reduce health costs by focusing on increased efficient and effectiveness of services. This is the aim is targeting at minimizing the errors occurring in different health organizations or health facilities and so on. Provide education, consultation to healthcare managers, organizations and professionals. This is a strategy to see whether they meet the required standard or what we call the best practices practices. Strengthen the public confidence in quality of health care. This is strengthening public confidence when an organization is accredited, meaning it has been evaluated. And they have seen that this actually organization meets the best or is practicing the best practices. So that builds public confidence to that organization and also in service delivery. Reduces risk associated with injury and infection for patients and also staff. As we said that this was aimed at meeting all the required standards, whereby it now reduces the risk, whereas patients are safe from infections. Also, it reduces risk for the staff members or the working staff in an organization, in an healthcare organization. So moving to another, we are going to see now what are the benefits. Benefit number one is health, promotes health, safety, and welfare. So you see, like when an organization is accredited, it enables to promote health, safety and welfare of the people who are using that facility. It serves also as a consumer protection, because as we are looking, if they are able to accredit an organization, means they are able to they have looked to various factors that may be about leadership, about diagnostic treatment processes, and they are come up with a report that this organization meets the required standard. So it is protecting the consumers or the people who are depending on that organization. Provides essential skills that are required in health, like when they are evaluating and looking into details on the organizations, healthcare organizations, they are maximizing the skills that are required in improving those healthcare organizations. Promote professional mobility and enhances employment opportunity. This is mainly for the graduates, as one is able to move from one place to another, the opportunities are increased. Determination of eligibility of federal funds program and student aid. So accreditations is also used to measure the eligibility of federal funds. These are funds which are given to help organizations to improve their standards. It enhances national reputation and also recognition. This means that when something is accredited, it gains a reputation from different stakeholders, from different people, and also for a professional person in that area, you gain recognition. You are known of your services that you have. It also helps to promote standard practices. And lastly, it's an indicator to funding partners. It means that those people, like private and government stakeholders, those who help in funding those organizations, they help their confidence when the organization is accredited, meaning it's offering its service at highest level. So the major difference between licensing and accreditation. So we say license exist primarily for public safety and well-being of consumers. On the other hand, accreditation is the both process and credential. Typically, licensing is involuntary. This one, you are not forced. You don't have options. You have to get a license for you to run your activity or your organizations. But accreditation is a process is voluntary, meaning you can hire a private organization to monitor or to evaluate your organization on terms if it meets the required standard. Individual facilities, program, or organization can be licensed. Here we are seeing that various facilities, programs, organizations can be given a license so that they can operate their activities. But on accreditation is only organizations, agents, or programs can be accredited. So as we are seeing there on the diagram, this is we are seeing accreditations and licensing and certificate. We are trying to figure out the differences that are there. You see, one is voluntarily, licensing is in voluntarily, and also certification is voluntarily. Because I didn't talk much about certification, let me take a second and talk on it. So certification confirms that an individual or an organization meets a minimum set of predetermined and standard criteria to function. Certification may be an individual or entity to provide the services. This is what I didn't talk much about. So moving on, let's now come to the Joint Commission. The Joint Commission has the mission of improving healthcare for public. This is achieved through collaboration with other stakeholders. Their work is to evaluate the healthcare system organization and inspiring them to excel. This is by providing safe and effective care of highest value and care. This was founded in 1951, and it evaluates and accredits health facilitations. They have said that they also accredit like 20,500 healthy organizations in the United States. What are their roles? The role number one is setting the quality standard. They evaluate the organization performance, how it's running its activity, advancing safety, and also the quality. The safety is all about consumer and also the staff of the organization. Transforming the healthy organization. They say they transform the health organization. Also, they have accredited services. As we said that they give the accredited services, they come and they evaluate if your organizations meets the standards or the best practices, then they accredit you, and then you are going to gain a good reputation. Moving on, National Committee for Quality Assurance. This also has a mission of improving the quality of healthcare. It helps serving people stay healthy and save countries money from wastage. Also, this has also some accomplishment, because they also do healthcare plan accreditation. They look at the different organizations, their health plans, and they accredit them. They have also what we call patient-centered medical home recognition and the quality solution group. This is some of the achievements they have made so far. Let's look to their roles. Role number one, they highlight top performers and drive improvement. They look at different organizations, healthcare organizations. They look at those ones which are performing very well. From there is when they inspire others to drive into improvement. Measure the quality of medical and practices. They also measure the quality of medical the consumer are given, and their practices, are they meeting the required standard? Helping in measuring and improving quality of both government and private clients. They say this committee, they are also hired to measure the quality for both private and clients. So you can hire them, they come and they measure and they make recommendation on how to improve the quality of both private and government clients. So let's look also US Department of Health and Human Services Agency for Health Care Research and Quality. This is a federal agency agents charged with improving safety of the American healthcare system. In US, they say healthcare system prevented like 1.3 million errors. This means they saved 50,000 lives and avoided the wastage of 12 billion US dollars. Let's see the roles they play. It develops tools and the data needed to improve healthcare system. They also invest in research of national health delivery system. These agents also create materials to teach and train healthcare systems and also professions. They offer education, generate measures and data usage by providers and policymakers. They generate measure and data used by providers and policymakers before making policies, and they have the data that you should compare and contrast before you make those policies. So let's also look at US Department of Health and Human Services Agency for Healthcare Research and Quality. So the National Quality Strategy serves as a framework for aligning stakeholders across private and public sectors in America. The first, in the federal states and among the states in USA and also local regions. In 2011, they established 3 aims and 6 priorities. The 3 aims are to better the care, health for the people and communities, and affordable care. So in the 2011 annual report, it features national strategies and priorities actions. So let's look at the 6 priorities. It's about making care safer, ensuring care among the partners. This among the 2 partners, one is ensuring the other one is safe, and also the other one is safe too. So provision or promoting and prevention of treatment practices. This is like improving the ways we do in preventing and the treatment practices. Promoting effective communication and coordination. This is all about the way people are communicating within the healthcare system from one party to another, and also the way they coordinate to bring up an effective actions within the healthcare system. Working with communities to promote wide range practices is all about involvement or inclusivity of different people within the community so that they can work to better the standards of the healthcare system. Making the healthcare system affordable is also like levelizing the healthcare sector, because of maybe those people from different social class, they can be able to afford from the highest, middle, and the lowest. They can be able to afford the quality health care that is required. Another thing I'm going to talk about is Centers for Medical and Medicaid Services Quality Initiative. CMS is a group of professionals from different backgrounds. This can be from clinical, scientific, public health, legal, IT, information technology, project management, academic, business management field. The initiative aim is to improve the quality of healthcare system through accountability and disclosure. It requests information in transforming clinic practices. So it has a quality strategy which involves physician quality report program strategy physician quality reporting program strategy and quality improvement organization. It's also developing of quality indicators for inpatient rehabilitation facilities. It also do what we call quality measure. It measures the qualities of different healthcare organizations. Also, it has post-acute reform plan. This is what all they do. Okay, let's now see on the Institute of Medicine. To L is human. Let's decide by defining what is medical error. Medical error can be defined as the failure of a planned actions to be completed as intended, or some others people can say is the use of the wrong plan to achieve an aim. So, according to United States, at least 44,000 people and perhaps as many as 98,000 people die in hospital each year. This is as a result of medical error. It is indicated that medical errors has resulted to the loss of income, which is in between 17 billion US dollars to 29 billion US dollars. As you can see, this is a lot of money per year, hospital nationwide. So there is also what they say, like, what are they going to do? They are saying priming in individuals does not make the system safer and prevent someone else from committing the same error. So they are looking at various ways to reduce possible errors in that time, in the errors that we are going to talk about in our next talk. So let's look now at the significance of this. The first one, it aims in reduction of errors. So this is aimed at the reduction of errors. Those errors are also said like diagnostic error, treatment, preventive, among others. Also, it establishes national focus to create leadership research tools, protocols, and to enhance knowledge base about safety. These are about teaching people on various ways that they can be safe or they can apply safe measures in the healthcare system. Identify and running from errors by developing nationwide public mandatory reporting system. This is the system of you identify the errors, you create a way that a reporting system that will help also to lay out strategies in order to eradicate them. Raising performance standard and expectation for improvement in safety, and also implementing safety system in healthcare system organization. This health system, they are aimed at protecting the staff and also the patient. Back. Let's also see 6 aims of transforming the healthcare system. This is according to the report. They propose 6 ways of transforming the healthcare system. The first of the 6 is safe care. This is all about avoiding injuries to patient, like provide patient and also the staff. It involves those practitioners who are involving in all the activities in the healthcare system. Effective care. This is all about providing care based on scientific knowledge. This is, as we know, scientific knowledge is the most widely used all over to discover so many things, from medical field and so on. Patient-centered care. This is providing respective and responsive care that ensures the patient values, guides, and clinical decisions. This is all about involving patients in the process of diagnosis, treatment, and so on. You care for what maybe their preferences, their needs, they are respected. Timely care. This is all about reducing the for both recipients and providers of care. This is where we find that some people may go to hospital, they wait for a long time before they are given certain services. So according to the report, they propose that timely care should also be considered efficient care. This is all about avoiding wastage of resources, waste of resources and other things that are involved in the healthcare system. Equitable care. It's all about ensuring the quality of care does not fall because of characteristics. This is maybe of one person is coming from certain socio-economic status, geographical, or the gender. So let's move to the next. Let me see if there is a file. Let's also see the criteria and the example of 5-star rating in a nursing home. The criteria used by CMS is the first one is the health inspection. They inspect different health systems, how they are working, how they are coordinating their activities before they start rating them. Staffing. This includes the different staffs that are involved in the healthcare systems, like the managers, different people within the nurses, professional practitioners, and also different people who are working in the staff. Also, they base on using the quality measures. Quality measures is all about looking at the best practices within the healthcare system. Does it meet the required standard, or it has? So they also to rate the other one, they look at different factors that promotes or that are involved for an healthcare system to be named as a standardized healthcare system. So this the picture is this the picture we are seeing here is the picture we are seeing here is the examples from the Rwandan government. They are showing the rating 5-star rating, how they are rating. As you can see, there are figures, and also on the far end here there is the way they are rating the 5 stars and also the color representing each of them. So for instance, you can see for the orange color there is also one, there is 7%, 17.1, and also for the dark blue color we have 39, we have 20%, and we also have for 14%. This all goes with the number of beds. For instance, in 39% they have 60 beds. They are also showing us the beds between 6 and 20, and also 120 beds. So this is the one example of one way of rating a sample of rating using the nursing homes. So as you see, this is one of the a standard ward for a patient. As you can see, it has different parts. As you can see, these are some machines. They have nice beds here. They are adjustable. They have different, even the hygiene is improved. So all these places showing different how a standard ward should look like. Okay, so in conclusion, licensing, accreditation, and certification are significant when one wants to improve the healthcare. Improving healthcare system involve different stakeholders. As we have seen from the above, there are different initiatives, there are different agencies that are working in hand to ensure that everything is done. Different initiatives have contributed a lot of in improving healthcare. This has been already discussed. Fixing the errors with the health can save the life and also the wastage of resources, as we have seen from the previously about maximizing errors and also working hard to save the lives of the people. These are the references where the information is derived from. If you can have time, you can go through.